Hey friends, it's Susan from Lakes Like Mine. Today I'm going to be talking with you a little bit about diagnosing lipedema. I get questions about this all the time. So I thought I would see if I can kind of wrap this up into one video for you. This is kind of the scenario is a lady goes online or someone tells her, hey, I think you might have lipedema. They think they have it. They've seen pictures. Their legs look like mine. And they're like, well, who do I go to diagnose? So one of the things that's really interesting about lipedema is that it's not any particular doctor type. So no specialty owns lipedema in the United States. Right now, anybody that is a medical doctor, an MD, an osteopathic doctor, an OD, a nurse practitioner, or a physician's assistant who is working under the guidance of a doctor can diagnose, prescribe a treatment plan, or prescribe medications. So you can go to any of those folks that you normally see to ask for a diagnosis. And what's interesting is that formal training for lipedema is not included or prioritized in most of the medical specialties. The Lipoedema Foundation recently posted their roadmap for research, and they cited that. And they said that the only specialties that are trained formally or even tested about lipedema are the American Board of Obesity Medicine, and they have some questions in their exam question bank. And then the American College of Cardiology, they also have some knowledge of lipedema in their competencies that are expected for people who are going to be practicing that vascular medicine. But other than that, like your standard nurse practitioner, your standard MD, OD, PA, whatever, they're not getting training in lipedema right now. So what usually happens in like the majority of cases is a woman will walk in and they'll be like, I think I have lipedema. And then one of two things happens. Their doctor's either like, I've never heard of it, but let's do some research together and see if we can get you figured out. Or the doctor's like, you don't have lipedema, you're obese, and we need to treat you for obesity. And that happens all the time. So I tell women, hey, whenever you come in, and let me pull it up here because I've got several of them in my desk. When you come in, you need to have some information that you can show to your physician. And like I said, it may be because they're fat phobic and they're not going to treat obesity, or it's because they just haven't heard of it. And in my case, what happened was I came in with a pamphlet from the Lipoedema Foundation. You can get these free or even download them from their website and print it yourself. But it at least gives your clinician a little bit of information about this disease, right? So one of the other things to know is that, okay, anybody that's able to diagnose in the United States, they can diagnose you with lipedema. The other thing is that there is no diagnostic blood test, so it's not going to be confirmed by pathology. Now, your doctor may still want to run a complete like CBC panel or whatever to make sure that you don't have something else going on with your body, but there is no blood test for lipedema. There is no genetic biomarker that's been fully identified that they can say, yep, you've got this genetic defect. They're working on it in the research world, but if your doctor says, hey, let's do blood tests to confirm your lipedema, they probably aren't familiar with the standard of care. So you can go visit the Lipoedema Foundation website if you want to print out the diagnostic criteria. But basically, I'm going to tell you what it is. And again, I'm not giving you advice or certainly not medical advice. I'm just a person. But it's basically they take your patient history and they're going to find out whether or not like your mom or your grandma or somebody else has legs that resemble a lipedema leg. It's not required, but it's definitely a sign. Like for me, my mom had lipedema, and I actually had like a great grandma who had it as well that my mom can tell me now from her memories, right? So they're going to ask about like, do you bruise easily? Have you had trouble losing weight? What have you done to lose weight before? They're going to, find out what your situation is. And then they do have some diagnostic criteria that they use as part of a physical exam. It's almost exclusive to women. It's going to be bilateral and symmetrical enlargement of the limbs, minimal pitting edema. So if they press their thumb in there and, it leaves that almond shape when you're pitting, that's not what they're typically going to see, especially in the earlier stages of lipedema. Easy bruising, persistent enlargement of your limb even after you elevated it. The arms might be affected, like mine, right? And then there's just limited weight loss in those affective areas. And then the last thing is they do a thing called a stimmer sign test, which they go to, if this was your foot, they go to your middle toe, like right after your big toe, and they try and pinch it just a little bit. And if they're able to pinch it, then that's a negative stimmer sign. If it's too puffed up and swollen, then that's a sign for lymphedema, right? So they do that stimmer sign test just to see on your foot, to see if that's negative. And then so that's some of the diagnostic criteria. The other thing is that some doctors now are starting to use tests like ultrasound. It's still very early in that the time frame. There's not a lot of published research yet on using ultrasound. So there are a couple of papers out on PubMed if you wanted to talk with your doctor about it. But if they're not familiar with looking at lipedema skin, the fascia, the nodules underneath the skin, they're probably not going to be able to recognize lipedema. There's some specialists out there who really know what they're looking at, both in the therapist world and in the surgeon world, who've been using ultrasound to test. But you go to your standard doctor, your standard PA, they're not going to be using ultrasound to test you. So the other thing is when your doctor wants to give you a diagnosis, right now in the United States, they use this International Classification of Diseases code it's done worldwide, right? And there's two different standards. There's ICD-10, which is what's used in the United States today. And then there's this new version, it's ICD-11, hasn't been implemented in the United States yet. So there's no code for lipedema specifically in the version that's being used in the United States. Elsewhere in the world where they've adopted this new standard, there actually is a code for lipedema. It's EF02.2, right? So that's really easy. When a doctor can go through their charting system and they see this code, they're like, oh, it's a real thing. And usually there's something for them to click on to see more information, right? I have this in a post that I just did about diagnosing lipedema, and I'll have it in there. But they use codes right now that are related to like swelling, like lipomatosis, adiposity, chronic hereditary edema, and stuff like that. They kind of cobble together some codes that when it's put together, it's like, oh yeah, I can see that that's lipedema. So hopefully what'll happen in the next couple of years is that the United States will adopt the ICD-11 standard, get all their databases and stuff up to date. So then if you can actually walk in and be like, here's the code, EF02.2, right? So anyway, that's how doctors can help with the diagnosis. So a lot of times what happens after you get diagnosed, as in my case, like my doctor was super helpful. She hadn't heard of lipedema. She read the stuff I gave her. She referred me to a certified lymphedema therapist and here in Oklahoma City where I live. And the therapist had some limited knowledge of lipedema. She's actually in a practice with a couple of other therapists. And they were always coming in, like before I had surgery, after my surgery and stuff, and feeling of the nodules. They were palpating those so that the other therapists could actually experience what lipedema is. Now, they told me after I started coming to them for therapy, they definitely have other patients that have lipedema that have been coming in for lymphedema reasons. So that just like me, I'm more advanced and I have lymphedema too. But we used my experience with that therapy clinic to help train the other therapists so they could be able to recognize lipedema. Now, interestingly enough, they don't diagnose lipedema. They're not, CLTs aren't supposed to, they're not diagnosing people, right? It's doctors, ODs, nurse practitioners, and PAs, right, who can actually do the diagnosis. But if you're working with the CLT, a lot of them can recognize lipedema. And what happens is your CLT or your physical therapist put together treatment plans based on what they treat, right? And then the doctor goes back and approves it in the chart, and they certify that it's medically necessary so that then your insurance will pay for it. So really, they're working in conjunction with your doctor and coming up with that treatment plan. So what's interesting too is that the treatment plan, a good one, will have information that the therapist will be doing, right? Like, so they're going to be doing manual lymphatic drainage, and they're going to be helping you with skincare and helping you pick your compression garments and get fitted for the garments and all that kind of stuff. They should also be educating you as the patient on what you're supposed to be doing at home. And a vast majority of the work is stuff that you as the patient have to take on at home, sadly, with lipedema. So, once you kind of get your limb decongested, it's on you to wear that compression. It's on you to pull the sugar out of your diet. It's on you to swim or walk or whatever you're doing, dry brushing, manual lymphatic drainage, all that stuff, that happens every single day. And there's nobody that's seeing a therapist every single day, right? But that's just the facts, right? So anyway, that kind of should help some folks understand, like, who do I see? You see a doctor. Any doctor. What I'm going to say is, if you have a doctor that fat shames you or who just totally dismisses you, even though you've looked at those criteria, you're coming in saying, hey, it hurts when my cat walks on me. I bruise all the time. I promise you, I've had, whatever. I've been on the diets. I've done all the things. I'm just not losing weight. If they sort of dismiss you and say, oh, go lose weight or whatever, check with another doctor. Check with a PA, check with somebody else for a second opinion. Don't deal with some doctor that treats you like crap because of your size or your symptoms or your weight or whatever. That's not cool. And, even though there may be like a preferred provider or whatever, find someone else. What you want to find is a doctor who listens to you, who believes you, who will help you, guide you. They understand too the burden of the self-care stuff that's required. And they don't just automatically write non-compliant in the chart. Like, if you come in and you're not wearing your compression because whatever, you couldn't bend down that day and get your compression on, they may make note of it. They may help you figure out easier compression or whatever, but they're not just like, you're not compliant, I'm hands off, right? So I hope that helps somebody. And again, I'm just going to say my caveat. I'm not a doctor. I'm not a medical professional. I have just been through this, my personal self. I have done the research on who can legally diagnose you, though, in the United States. And I do have links in the blog post that I'm going to put up about this. And then I'll also have links for the diagnostic criteria from the Lipoedema Foundation in the description of this video as well. So my last thing is if you like what I'm doing, I'd love for you to interact with me, comment, whatever, and please subscribe. Please click like. It really encourages me as somebody who takes the time to make this content for you. And also, the number of subscribers really does matter when it comes to working with YouTube. It lets them know that, hey, she's doing something valuable, and we need to pay attention to her and bump her up in the algorithm. So please like and subscribe, and join me on legslikemine.com and all my socials. I've got different content all over the place, including fashion, my surgery stories, stuff about my footwear line where I'm making shoes just for ladies that have lipedema, my books, all that stuff. So follow me, and feel free to reach out to me if you have questions too. I'm happy to help, and I'm happy to go dig and do research on stuff you may have questions about and see if I can come back with answers for you, or at least some place to go look. So anyway, have a great day. I will see you all later. Thanks. Bye.